More info now. Local health officials say if there's ever a case confirmed of Ebola in New York, they are prepared. CBS 2's Elise Finch on how the virus is spread and what's being done to keep people safe.
These rooms at Bellevue Hospital are being prepped to handle patients with Ebola. Informational posters have been sent to emergency rooms across New York City. And Health Commissioner Dr. Mary Bassett says those actions, plus several more, ensure that the city's healthcare community knows exactly what to do if they come across a person who might be infected.
It's identifying the case, isolating the case, evaluating the case, establishing the diagnosis, and then getting that person into safe and effective care, and then tracking down all the people with whom they may have had contact.
Dr. Rassi Hassad is an epidemiologist and professor at Mercy College. He says a person with Ebola is only contagious when they're experiencing active symptoms.
If you have someone who is infected, any body fluids or secretions that you come in contact with is potentially infectious. Blood, saliva, sweat, fecal matter.
Dr. Hassad says Ebola is not an airborne virus, but it can live on surfaces like airline tray tables or armrests for more than 2 hours. And airline travelers we spoke to say they're alarmed since there's no vaccine and no cure.
It's pretty scary. It just makes me a little more hesitant, a little more cautious.
So I'm just, very cautious about washing my hands and what I'm touching, and I carry wipes with me.
Still others say they aren't worried at all because the odds are in their favor.
At this point, with one case, with 320 million people, I'm not concerned.
Dr. Hassad says most people will never encounter a person with an active case of Ebola here in the United States. But if you're flying and concerned, wiping down a surface with a solution of at least 70% alcohol will kill the Ebola virus. Elise Finch, CBS 2 News.
And since August, the city's health department has received more than 80 calls about suspected cases of Ebola. Most of those patients were eventually diagnosed with malaria. None tested positive for Ebola.